So now we have two roving mics that could go around the room. First of all, identify yourself and then pose your question, please.
Thank you. My name is Ike Anya. I'm a public health doctor, and I'm on sabbatical from the Westminster Council, setting up a public health outfit in Nigeria. And my question is, or comment is about engagement. I think it's very important. You know, there have been lots of useful tools, lots of useful information, and it's very important to think about how to engage with the people who need. It's interesting when we were talking about dissemination, you talked about the high-profile research, the high-profile research projects, and that's exactly, I think, one of the challenges. I think you need to identify the people on the ground, if you like, the coalition of the willing. In every hospital, every setting I've worked in Nigeria, there have been one or two people, you know, who are doing different things, being innovative, engaging with new things. They're not always the ones who collaborate in research or appear in. And I think it's about identifying those people. And I think there's a hidden resource in people like me, and this is shameless publicity, but people who understand both the system here and the system in those developing countries as well, and have the contacts and needs. That's all I wanted to say. Thank you.
Thank you. And would any of the panel members like to comment?
I totally agree with that, and I think that echoes a sentiment of much of what I was saying about what we call the cognitive surplus, but the question is about engagement. So it goes back to the reward and ring condition. So why would you do it? So statistically speaking, people do stuff for sort of 15% is because of money, and so 75% is about other stuff. So recognition is an unbelievable, powerful ally that is completely unutilized, as is the sort of joining up the dots on people and opportunities that creates that reciprocity, which again is a huge ally. In fact, McKinsey did a big research, and the number one reason for creating collaboration was not even on their first survey, but was the notion of giving and getting help, because it creates reciprocity. So there's a sort of thing, go back to the theme of South to South. If all we could do was just open up the framework, digitally speaking, but obviously engaging in real-world conversations and thinking and innovation, and you crowdsource it, but to get recognition is the beginnings of how to, I think, create that engagement that you're after. And that's just the start. I mean, it gets stronger and stronger and more compelling as you build out the model.
Any other questions?
Hi, my name is Tanith Palmer. I work in capacity strengthening at the Liverpool School of Tropical Medicine. I've got kind of a two-part question. Firstly, it's to find out a little bit how you're engaging with the hard-to-reach areas in LMICs rather than just kind of the bigger organisations. And also, I know that Babatunde mentioned the importance of SouthSouth mentorship and how this actually falls under that, and how Southern Partners have actually been involved in the development of this.
Let me pick up the first part, and I'll pass to the others for the others. The absolute strength of the network, and this has been from the beginning, that most of the people that use it are not part of the big Kemry Welcome programs and the major Welllcome Trust overseas programs and the big American institutions that work overseas. Most of the people that have taken the e-learning courses and share resources are from much smaller independent units that don't have the support that the big organisations have got, because the big organisations don't need the network. So we've had something like 26,000 training modules have been taken on the platform, and most of the people taking those are in small organisations that don't have any access, and that's the power of using digital technology and making these things accessible, because these are the people that can't normally access training. So it's the very point of it to access groups where there isn't any local support. But can you pick up the South to South bit? Maybe both of you.
I didn't get exactly what you wanted me to say, but the thing about it is SouthSouth. What I'm talking about, SouthSouth Corporation, mentorship, is the fact that we have so many very good scientists in Africa, centers of excellence, I'll call them, in Africa, who can mentor those other sites in Africa where there's less experience in conducting clinical research and clinical trials. And I'll give you an example. We have a consortium at the moment which we are running and doing some clinical trials. What we try to do is to identify those in the so-called weaker, let me say weaker institutions and areas where they will need help, and try to match them up with another another scientist within Africa. So that's what we try to do. I hope it answers your question. It does. Yeah, take it.
Yeah, the idea really is that we've had research nurses in Malawi talking to research nurses in Nepal, explaining to them how to set up community advisory boards, and it's this peer-to-peer support that's really strong. And the way it works is an online science park. People can work within their own groups and feel safe and confident to have those dialogues and share resources. So even though it's, we set it up in Oxford, it's literally only, a small operational team in Oxford. The whole point is it's on the ground, and there's regional faculties, and it's all about the peer-to-peer support within those both the centres of excellence and, as you say, the sites that are coming up as well. So most of the activity is between peers in those settings. So it's sort of fundamental to it, really.
Next question.
Hi. Good morning. My name is Raul for the International Consortium for Severe Acute Respiratory Infections. It was mentioned about one of the barriers to embed clinical research more on everyday clinical practice, the ethics process. So the question is for the panel, how to overcome this barrier, because it's a danger to see ethics to be a barrier when it's supposed to be protecting the individuals and to actually foster research in a way that will benefit the individual.
Oh, very good question. And I think the way that ethics has focused so far and the trajectory that it has taken, research ethics that it has taken so far, is that it's coming from the field of clinical trials. And so what people try to do is to sort of fit those concepts of clinical trials and clinical trial ethics onto all of research. And that doesn't work, and that's why it becomes a barrier. I think what we need, again, as I said, a new paradigm for the ethics of health systems and health services research. And there are two parts which I think are relevant. One thing is that the researchers themselves don't understand very clearly the boundary between what is the health systems activity, what is the clinical practice, and what component is the research part. Because mostly it's the component that the questions that we are asking in the sort of studies that I'm talking about, they're not related to whether, for example, is gentamicin safe to give to children, or whether paracetamol or ibuprofen are good drugs, etc. They're asking different types of questions. The questions are, is it appropriate for a midwife to give, for example, an injection for postpartum hemorrhage? So we know the injection works. We know that how to manage postpartum hemorrhage. Those are not the issues. The issues are something different. And I think neither the researchers nor the ethics committees have come to terms with this sort of changed paradigm of the research. And I think that's where we need to make the difference. We feel that we need some sort of guidance for this area so that we can make it easier for people to navigate this course. And I agree with you. I mean, to read out a 20-page or even a 5-page consent form, for example, for something that is routinely done, the consent should be there, but for a different thing. It shouldn't be there for the things that they anyway would be receiving in clinical practice. So I think we need to change that scenario. Does that answer you?
My name is Talil from Save the Children UK. And the question I'm asking is, there are many non-governmental organizations that are operating in areas hard to reach and difficult to even get qualified staff. And majority of the health facilities in those places are manned by community health workers with limited skills and knowledge. How this platform can support the NGOs to generate evidence using the existing information. There are a lot of information available, but people are not making best of that information. And how the NGOs can be another platform to further democratize the research, which is nowadays isolated in the biggest institutions. Thank you.
Thank you. Yeah, that's an excellent question, and exactly what we want to be trying to catalyse through this. And it's what Ben said earlier about trials should be simple and straightforward. It's the message I hope we've talked about all morning, that we need much more pragmatic studies that answer local questions. And it's the frontline healthcare workers, the midwives, the nurses, the field workers who are there and ready and able to collect that sort of data and just aren't given the equipment and support and mandate to do that. And I think there needs to be much more collaboration between the traditional research agencies and the funding agencies like Save the Children and Oxfam and the normal types of charities like that. So it would be fantastic to work more closely with you and find ways to think about research being just part of the normal healthcare provision, which is exactly what Ben said needs to happen in the UK. It needs to happen even more so in the world's most difficult areas to work in. So thank you for that question. And can we talk later?
I'm Amelia from a global health network led by students. And I was just wondering what the role of the youth is in the global health network and how they can be...
I think Ken can answer that, because lots of your colleagues, the youngsters, aren't they?
The youngsters, okay. Yeah, thanks for the question. Back in Cliff where I work, we have a study grant for the youth, and it's targeting the high school students. So we bring them to our laboratories and we show them how laboratories works and how research is done and how we use the results for the research, disseminating the results back to the community. And youth should be involved because it's very easy to disseminate information back to parents and back to the community through the youth. And in most cases, you find that in our rural setup, most mothers are not learned. So if the youth are learned, they take back that information to their mothers, to their parents. And that's one way by which youth can participate in global health.
There's a question.
Hi, I'm Emily Firu, I'm a journalist. I was wondering, is there a quality control element to the process map? Because it's one thing to have a basic, health worker, using the process map, but how does he or she know that even though she's followed every step of the process, she's done it right, she's followed the highest standards of ethics, of methodology, and that the results she's going to produce and presumably share, will be of the highest standards possible in every possible way?
Thank you very much. Yeah, absolutely. And we've touched on this a few times this morning, haven't we? It's about standards, and all over the platform we talk about quality research and trusted data, and that's essential. There's two elements to the answer to that. The guidance notes and the resources that we put up on the platform are all peer reviewed, and they've also been donated from really credible sites that are already conducting research that's been published and is well recognised in its own right. So the material is reviewed. So that's the sort of embedded resources that are on the platform. The other element are the discussion forums and the blogs. Now, we've learnt a lot on this road for not being anywhere near where Roger is on this journey, and we were reassured really early on that people share what works and they share what's good. So we do monitor the free areas of text on the platform, and we've never had to take anything down. We check it's right and it's appropriate. Roger might like to touch on this behaviour, because it's something we've learnt quite a lot about, that people do behave and people do share good quality information, but the stuff that's on the platform that is embedded is peer reviewed and is high quality and is compliant, because it's the high quality research and standards is absolutely imperative.
Yeah, I mean, obviously this is a much more delicate setting because of the implications. But the way that the rest of the market in the world's moving is self-policing. So you've got, again, that goes back to the power of crowdsourcing. So if you take a site like Quora, it may be a brand you may want to know, but it's what Yahoo Answers, I think, always wanted to be. It is an environment where people just take a pleasure in trying to answer other people's questions. And statistically, about 15% of people have that bug. They really love going in and answering questions, rightly or wrongly. But it doesn't matter if it's wrongly, because guess what? Other people are going to validate the strength of that. And for those sort of, and again, using sort of numbers, 5% are defined in digital speak as killers. So if you've done a workshop, which I'm sure many of you have, there's always one person that has opinion and keeps having opinion, and they keep on sort of sidelining and causing some drama. You'll always get those characters in. But the point is the crowd will recognize the quality. And it goes back to that example of my Starbucks idea, which is a wonderful way of just letting the community speak. And you will find the quality ideas arising from that. And if there's any issues, because it's a self-policing environment, it will be flagged. But it is a very significant issue, especially in the medical sort of circles.
Great. Abba and then Babatunde.
So I had a question actually, so if someone else wants to respond to that.
Yeah, I just wanted to add to what has been said, and I understand your point quite clearly. In Africa, at least with most ethics committees, if you want to do intervention research, then you have to write protocols, you have to write or follow the standards. But if you want to do simple research that probably will not involve interventions, you still have to draw concept and write a letter to the ethics committee and or whatever ethics committee that you subscribe to, and get them informed, and it has to be approved. So you don't just go about doing research because you want to, because you've learned from the process map.
Okay. So we'll take one more question from the audience, and then Abba, and then we'll close the event. Please go ahead.
My name is Ricardo Araya. I'm professor of global mental health at the Center for Global Health, jointly between the London School of Hygiene and the Institute of Psychiatry. We conduct research in more than 40 low and middle income countries. One of the biggest challenges after the microphone is actually recruiting young and bright research workers, and even more difficult is actually to retain them. And one of the reasons for this is that is exactly what Roger was making a comment before, is that they don't see there are enough rewards. So, and then when you hear people like Ben sort of saying, that most people make decisions without evidence, let alone politicians and also doctors, it's kind of not really attractive for young people to come and join us on this crusade. So my question is, I see that here there is a tool, but none of these tools is going to be successful unless you have customers. And I think if there is a customer that we should be targeting some of these tools, it is in the future generations. And to some extent, I feel that we're not being very successful with this, partly because the rewards are not there. Essentially, as Roger was saying, there is not enough money. There are much better career prospects for young, bright people in other fields. So I wonder whether some members of the panel can help me to kind of sort of, get some something that I can go around the world and sell to these young people so that they can come and join us on this crusade. Thank you.
Okay. Who wants to take on this marketing question?
Just very, very quickly, there's a very interesting lens you can use to think about people in digital. So there's a chap called Professor Bartle who describes the profiles of us all in a digital space as 4 types. I mentioned one earlier, which is killers, socializers, explorers, killers, and achievers. And they all demonstrate qualities that are in us all. About 90% of us are socializers. I mean, why is it that most of us, if we're on Twitter, for example, we want more people following us than we're following? Stephen Fry's a great example, because Stephen Fry's got about 5.5 million people following, and I think he follows about 6 people. It infers you're kind of an influencer, and that plays on your social sort of traits. Explorers are people that love to go explore. We've all got a friend in our network that when you've gone on holiday, you just give them the task of go and find the best holiday deal, and they will love the idea of just squirreling away and finding out the deals and the packages and the locations, and they come back and they're like, look what I found. The explorers, the achievers are people that love Foursquare, for example. They love the badges. 25% of a community are very driven by badges and so on. And then, of course, you've got those special folk, the killers at the bottom. But if you look at people through that lens, it doesn't matter what age group. and what demographic. We're all humans and we've got these triggers. And what I'm really compelled by is the fact that we all have this free currency that we can start applying immediately. And recognition is just one wonderful ally in terms of this process. And what you do is you create this transparency, so you create this currency of trust. And you move that forward. It's the reasons why someone will hire someone is because they've been more participative, they've been more collaborative, they've shown that they've actually demonstrated certain qualities. So actually, the answers are all there. It's the question is whether you want to apply these nudges and these carrots in a certain way.
Yeah.
If that helps.
Trudie.
Yeah, thank you. That's a fantastic question. And I think those points are excellent, Roger. We were given a grant a couple of years ago to develop something else within the platform that we called professional membership scheme. And the point of that was to try and raise awareness and recognition for people who take on research as part of their normal health systems work. And it's the same as Tunde touched on earlier. That's at the moment, in most low and middle income countries, working in research just isn't recognised. So nurses are employed as nurses, but they're actually doing a clinical research nurse job. Clinicians the same, and then moving out to the healthcare workers is just really tough. But countries have got to be supported, and maybe that's where we can work better with people like Save the Children and Oxfam and DFID to make working in research an acceptable and mandated part of working in healthcare provision in low-income settings. And the professional membership scheme we've got within the platform gives people recognition for the core competences they learn as part of doing research. So it gives them that reward, and they can build up their way through tiers, and that's what the WHO funded us to do. So it's again, we haven't really made much of a sort of song and dance about that yet. Perhaps the next meeting will be about developing careers in research.
And giving out stars.
And giving out stars. We need more stars and certificates. But yeah, absolutely. I think it's fundamental. I'm
Great.
sure.
It's first to respond partly to this. I think recognition is a huge incentive. And an example which is slightly different from this context, but so WHO has something called collaborating centers. And the purpose of collaborating centers is we have centers, we designate them as collaborating centers when they can do WHO's work plan for WHO for free. So we don't pay them a penny. We expect them to do the work that we would be doing. We expect them to hold meetings for us. We expect them to do a whole lot of things. And why do people become collaborating centers? They don't get any funding for it. We don't actually even ask other people to fund them. And the only reason they do it is because of the recognition and the rewards of being, or the prestige of being a collaborating center. And I guess the problem with researchers at that level is that they never get to be, they may become the 15th author of a paper, but that doesn't get them anywhere. And some of them don't even get to be the author, so why would they care about this? And they don't get the money. So maybe we need to find the currency that moves them and that drives them, and see ways of why they would do it.
So the last question.
My question, that's to Trudie and maybe to some others. The question is, here we're talking about one stream of researchers who have gone through a very rigorous training, who have spent years in finding out how to do research protocols, how to do research, and then you come up with this tool and say, hey, guys, it's easy, anyone can do it. And all it takes is to be able to go through this process, and you're a researcher. So how do you justify the
not rocket science thing? Sorry, eminent colleagues.
So all the researchers out there are going to be very upset.
It's too bad, isn't it? But it's true. I mean, it's it is. It seems a very daunting task to write a complicated protocol, and maybe if you've got a brand new vaccine, you're about to vaccinate neonates in 10 countries, that's a big ask. But to do some of the more straightforward things, to get frontline healthcare workers to look at why mothers are dying in their communities, it's what Tunde said about his pen. It's looking at what's going wrong and thinking about what could we do differently and how can we gather evidence. And that shouldn't be daunting, and it's not rocket science. Sorry, eminent colleagues in the room. And we can, but it's taking what the eminent professors do and the sort of gold standard regulatory studies and adapting that in more pragmatic ways, and that's not that hard.
Okay, thank you. Now, because of the time constraints, we're going to stop the questions there. But there is a networking event after, so please feel free to approach any of the panel members if you have further questions. So now I hand it back over to Trudie to close the event.
Well, thank you all so much for taking up your mornings to come today. It's been fantastic that you've all come along and shown your interest. But thank you very much, panel. You've been fantastic. If you could, thank you for taking part. Thank you, Rosanna, for chairing so wonderfully and keeping us all together. We need to thank the Welllcome Trust for letting us use this amazing building and all these fantastic high-tech facilities and looking after us this morning. So thank you, Welllcome Trust. And finally, just a plea, or 3 pleas. Can you go and have a look on the platform, see what you think of it, and tell your colleagues and collaborators and the groups that you work with. For our research colleagues in the room, share how you do it and your methods, all that clever stuff that we need other people to learn about. But finally, we need more partners. We've got so much more that can be done with this platform, and people coming up with fantastic ideas all the time, and we need to invest in this technology we've heard about. So please do get in touch and come and work with us. Thank you all very much indeed.